So the COVID-19 pandemic's challenged many of our traditional democratic civil liberties through the implementation of invasive emergency measures. While governments are responsible for the protection of their citizens, this protection often includes a temporary suspension or restriction of other essential liberties. So how do we balance public safety with the integrity of those liberties? How do we prevent these changes from spilling into the future? We've got a great panel to discuss this. We have the director of Big Brother Watch, Silkie Carlo, multi-award-winning campaigner and privacy advocate, Phil Booth, author, campaigner, former UK care assistant and whistleblower, Eileen Chubb, and Professor Anthony Glees. And they're going to discuss civil liberties under COVID-19. It's going to be moderated by Politico's senior tech reporter, Nancy Scola.
Hello there, everyone. My name is Nancy Scola. I am a longtime technology journalist based here in Washington, D.C. in the United States. I mostly write about tech and the intersections of tech and politics and policy. On Twitter, I am at Nancy Scola. Please feel free to follow me there. I'm thrilled to be here today for a timely and important conversation, and that's about the state of civil liberties during the COVID-19 pandemic, and importantly, what happens to the state of civil liberties after the pandemic is over. And this is the perfect time to be having this conversation. We have a year of living with the pandemic under our belts, and we're entering now into this vaccine stage of the pandemic when it's a great moment to look ahead at what our new normal can and will be. And we're joined by this topic. We have Silkie Carlo. Silkie is the director of the advocacy group Big Brother Watch and a lifelong campaigner for civil liberties. We have with us Anthony Glees. Anthony is a professor emeritus at the University of Buckingham and an expert on European affairs and much more. And we have Phil Booth. Phil is an identity and privacy advocate who led the successful No to ID campaign in the UK, who is now with the Med Confidential campaign. Welcome, everyone.
Hi.
So with that, let's get started. I want to start at a high level before we dig into specifics. Conversations like this are often set up as public safety versus individual freedoms, or as Stanford's Larry Diamond had it in the journal Foreign Affairs last year, democracy versus the pandemic. So Silkie, I want to start with you. Is that right? Are public safety and civil liberties necessarily in conflict here? And if so, how?
It's a great question, and yeah, I don't think they're in conflict. Well, they shouldn't be in conflict whatsoever, but they currently very much are. It seems to be like a zero-sum game, whereby also if during this time advocating for civil liberties, it can be read as not taking the genuine threats that we face seriously enough, and it's a real misreading of the situation. We've had very similar kinds of straw man dichotomy put up for debates around safety and surveillance as well. And I think it really comes down to the kind of political imagination about the way of doing things. Obviously, the kind of focus, I think what we've seen in particular over the last year, and certainly from a UK perspective, is a hyper focus about a certain way of doing things and a certain way of measuring success. And so that has changed between being, often that's measured quantitatively. So it's changed from being coronavirus cases or coronavirus related deaths or hospitalizations. There's a kind of desire to simplify quite complex challenges that we face into one kind of quantifiable goal, which means all kinds of other things are forgotten about. So there are some deaths and negative effects that result from the landslide of civil liberties that we've had. That's just not factored in. The kind of healthcare impact of some of the government's measures that have been taken hasn't been factored in. This idea has dominated that it's these particular measurables that matter and nothing else. I would like us to, if we had a healthier attitude towards civil liberties, I think we could have approached this situation with the sense of community, compassion, care, support, understanding, that gets a nation through something like the kind of crisis that we've been through, that could pull us through a pandemic. Unfortunately, we've actually seen criminalization, punishment, secrecy, and huge accumulation of power, which can help the government achieve on some kind of quantifiable measures, but I think in the long run is very dangerous to society as a whole.
So that's interesting. It's a conversation you sometimes hear about the GDP, right? The gross domestic product. It's measuring certain things, but it's not capturing a lot of what a country produces, and therefore it's just sort of simple idea of if you're measuring the wrong things, you're going to get the wrong metrics. If we're only measuring for deaths but not taking into account some of the health effects and that sort of thing, we're going to be making these calculations incorrectly. Is that?
Yeah, and also, even if we were using, it's an awful conversation to even have. I mean, even if we were using purely deaths as a measurement, then we also need to take account for suicide, and we also need to take account for the cancer deaths that we're going to have over the next 10 years because of the health impact of lockdown, the delays in diagnoses, avoidance of hospitals and the health system over the past year. I mean, there's some really serious fallout from this, even on that one measure. But I think also when we're talking about rights and freedoms, it's important to think about the whole picture. I think you can never really develop good policy when you have a completely myopic view about one particular issue or one particular thing to measure. And even if I don't think even the government would say that every single measure that they've taken over the past year has been the right one. But even if you were to take that position, you would still need to account for the huge amount of damage that's been done as collateral to that. The fact that we've had basically ministerial rule now for a year, that we didn't use the Civil Contingencies Act, which is legislation designed for emergencies. We've kind of reinvented the wheel, which is always a very dangerous thing to do in an emergency. We're living under ministerial rule. There's been no democratic scrutiny. We've now got emergency laws that look like they're set to stay for a very long time. We're talking about reshaping society with things like domestic vaccine passports, checkpoint society, some really, really long-term issues that now we're on the precipice of, which is why this is an important time to have this conversation a year on, because it's the difference between is the citizenry now going to kind of stage an intervention and say, no, we want a rollback of the emergency powers and we want to have democratic methods back, or are we going to enter kind of perpetual state of emergency and see a lot of this bad stuff normalized?
And so, Anthony, Silkie mentioned some of these stay-at-home orders. Phil, I'll check in with you just after this. Silkie mentioned these stay-at-home orders. We've had mask mandates. We've had forced business closures. What does that landscape look if you look across Europe for the last year from where you're sitting? How do you sort of assess the situation?
Well, it's a very good question, but it's also a very complicated question. And I think my starting point, I've often in the past found myself at loggerheads with Big Brother Watch. And what I find is I kind of agree with some of the general, motherhood and apple pie ideas. But when you drill down and look at these very difficult problems in policy terms, I come at them from a different perspective. So in the UK, what we have had very clearly, and it's clear to see the situation, an extraordinary pandemic. Pandemics have been defined as one of half dozen major national security threats over the past 6 or 7 years. And the government was completely unprepared for it, as Bill Gates famously pointed out many, many years ago now, that this was a big problem and we should prepare for it. Well, we didn't prepare for it. We had a libertarian government, which, to my way of thinking, is not a million miles away from what Big Brother Watch thinks about this. The pressure in the UK has been on the scientific and medical community to get a libertarian government to understand that in an extraordinary situation, faced with a virus to which the vast majority of us have no immunity, particularly if we're over a certain age, no immunity at all, that has left 124,000 people dead in the United Kingdom, then something serious had to be done. Now, the medical and scientific community were very clear about what needed to be done. The libertarian UK government was reluctant to do it, particularly led by the Prime Minister Boris Johnson. People may recall that a year ago he was making a big speech at Greenwich on how the UK was going to be an economic superman and outrun everybody else in the world because we were not going to whinge in a corner and stay at home because of the COVID virus. So from my perspective, the government policy was a libertarian policy, and it failed the United Kingdom. And what we've seen over the past year in the United Kingdom is that the scientific and medical community have really taken over. The government said we follow the science, but that was clearly nonsense. And when the Prime Minister himself practically died of COVID, it was clear they hadn't paid much attention to the science. But I absolutely agree with Silkie on one thing. This is a very, very big and important question, because we also know in the case of the United Kingdom that a very significant majority of British people support the scientific and medical community in wanting to have a lockdown as a means of getting on top of the virus before vaccination can have an effect. And there's spin-off issues too with vaccination. I mean, one of the things that I've been saying on Twitter, for example, is that I, for a long time, have believed no jab, no job. I don't think that people who work in care or the health service should be given the option of not having the vaccination. Displays their complete lack of faith in science, for one thing, but also a disrespect for their patients. Now, that's a very authoritarian thing to say. So how I see this develop, unlike Silkie, I think we will get back to normal once there's vaccination. And I think over the summer, whenever it is, there'll be a huge Saturnalian fest of liberty, and people will drink too much, and young people will make love too much, and all these things to celebrate this is over. And then once again, we'll go back to the more traditional questions of security versus liberty, in my view, a false opposition. And I'll just end really with two observations. As I say, we've got a libertarian government, and that's a big problem. And the right wing in the Conservative Party, which is the same right wing that propelled us towards the hardest of hard Brexits and the strongest of strong divorces from the European Union, has also been the group of people saying, oh, you don't want to have a lockdown and the economy is more important than life. Well, for me, the starting point is life. If we're all poorer but alive, it is better than some of us being richer and large numbers of us being dead. And I say that as somebody in the age group, of course, particularly affected by that latter policy. I also say, as I've said many times, I don't believe there is a conflict between security and liberty. You can have security without liberty, but you cannot have liberty without security. And security is the key to providing liberty. Sometimes, though, as in the COVID crisis, that liberty has to be removed. And let's be in no doubt, as Silkie has said, we've had an authoritarian style. Well, I'm saying authoritarian, she's saying ministerial government with very little parliamentary scrutiny. So that's been a problem. The final point, I go back to a big thing that I think the reason we're all having this conversation is not just because for the first time in our lives and in modern times, it has been possible to conduct mass observation of people and invade their privacy to an extent undreamt of before. And that has come into conflict with another big change, which has been the move from what you could call the sovereignty of the people to the sovereignty of the individual. And that move has been fueled by the social media. And we live in an era of growing individualism where individual views, however, gain traction through social media and then become a pressure that can be put on government. So the challenge is really, how we get out of the COVID crisis. That for me is simple. We stay indoors until enough of us are vaccinated that this becomes just like catching a cold and flu, and we go back to normal. But whether we continue to want to mine people's data, particularly in order to avoid another pandemic, put people in quarantine, stop them moving about freely, that is a question certainly that it is timely now to ask.
I want to kick it over to Phil. Phil, I'd love you to weigh in on that. I also want to take the opportunity to have you offer some perspective on the American experience, if that's okay. We have a unique situation where we have 50 states, 50 local governments, 50 set of rules very often, where we've had local leaders say, you look at these mask mandates, you look at these stay-at-home orders, don't bother with them. You should ignore them. Very often out of the sense of sort of pushback against government. Very often those states are the ones that have had the worst experience with the coronavirus. How do you look at that and say, okay, I'm guessing you're weighing in a little bit more on the civil liberties side, civil libertarian side. How do you look at the US and experience and say, okay, you can go too far in sort of, over calibrating towards some of those freedoms?
Well, okay, I'll come to that, but I think I want to come at this from the high level that we started at and pick up on some of what Silkie and Anthony have said. Our civil liberties arise out of two things: the rule of law and a human rights framework. And both of those still exist. They may have come under threat, and indeed this government is threatening the Human Rights Act of the UK. And there have been points at which rule of law looked pretty fragile, with the government attacking Supreme Court judges and the like. But those two things being in place in a public health emergency, as Anthony's mentioned, as we all know, there have been powers for a long while. Silkie mentioned the Civil Contingencies Act, which is a UK-specific piece of legislation that could have been used to manage this, but the government chose to make it up as they went along. But there are clearly a need for some extraordinary powers during something as potentially catastrophic as the pandemic. So the question that must therefore be asked, it's not this binary setting one thing against another. It is to ask, in the specific and in the general, are the measures being taken necessary and proportionate? And this is directly from the human rights framework, where we have freedoms. Government cannot do certain things, other people can't do certain things to each other. And those are supported within that human rights framework. And the crucial question, not just are they necessary and proportionate, is how do we know? So the government can say they're following the science, and the scientists, by and large, have done as good a job as they can of publishing stuff. It's not always easy to interpret that, but that information is available. What isn't available is the process by which, the means by which ministers have come up with all these various laws, and how they've been using the evidence, what the assumptions have been, and we can sort of work out some of that. So to look at across the US situation that you described, we could have a mini version of that, if you like, if things were being handled at a local level across the UK. We have what are called local resilience forums, which most people don't know were sitting there under Part 1 of the Civil Contingencies Act. And those things might have been the first line response. Instead, the government chose to commission a whole new test and trace system to deal with things. So there's a tension between, do we do something centralized and impose it across the piece, or do we beef up what limited abilities, capabilities we have already, and who actually coordinates that? One of the crucial thing here, and I think it's why we're having this conversation, is that we are running through a time, as Anthony rightly pointed out, where Parliament is not functioning as well as it should. Yeah? The point of Parliament is to hold the government to account and its policies and what it's doing. But with its massive current majority and with the way it's using powers, there are a few constraints. So this is where civil society and the general populace, frankly, have to step in. And as a campaigner, and like Silkie, I've campaigned on and around similar sorts of issues for many years. It's actually trying to find these things where, we're trying to stop the government stepping over lines which it is very difficult to come back from. If I give you, just to sort of draw this bit, my answer to a close for now, to give you a specific example, the contact tracing app. It's actually an exposure notification app, which was produced by NHSX. And there was a huge sort of outcry at the very beginning of the pandemic. It was very obvious that there were going to be a whole bunch of apps coming along, symptom reporting apps, contact tracing apps, and potentially test or vaccine apps. But with this one in particular, and the way that it was designed, which was also partially designed by GCHQ, our intelligence and security services, it would have meant that the NHS app, as originally designed, would have essentially given GCHQ ownership of that device for the rest of its functional life. Yeah? It was important that we didn't make that step, because this is something that would persist beyond the pandemic. And so there was a lot of pressure put from civil society organisations like Big Brother Watch and Med Confidential and many, many others, to make sure that that did not happen. And wiser head prevailed in the end. And they used the Google Apple API, which many other countries have ended up using as well. Now, whether those things are as effective as the sorts of apps that were used in China, where if you didn't respond to something from an official within 15 minutes, the police were knocking on your door. Well, that's I think a line further than anyone, libertarian or authoritarian in government, would be willing to do in a democracy. So a lot of this is big general sort of principles, and then addressing the specifics of whichever sort of policy or program or initiative that the government wishes to push.
So you mentioned this, just by way of quick follow-up, this part of the key dynamic here is the public and campaigners having the ability to decide what measures are necessary and which measures are not. Part of that depends on scientific information. Part of that depends on information that's being distributed to the public accurately, them being able to make fair sense of it. Do you feel like the media landscape in the UK and Europe allows that kind of conversation, allows that kind of distribution of quality information for people to make their own judgments? Again, to be American-centric here, we sometimes wrestle with the fact that the information that people are getting isn't high quality information. So the judgments they're able to make on whether I support this measure or don't support this measure aren't necessarily based in fact.
I think we suffer equally from a sort of polarized media, from bubbles, and from all the problems of social media that I think are well known. What I'm talking about, though, is the fundamental transparency that we require, again, under law, of things that are being done with people's data. And this is very much the angle that I'm coming at from here, is on those sort of data type initiatives. Okay. Without the transparency, then no form of media can report things correctly. But what we really pushed for was, and continues to be, the sort of transparency that means that at least you can point to the actual evidence. If some people choose to ignore it or report it incorrectly or what have you, unfortunately, that's a problem of the general sort of degradation of our media at the moment. But it is absolutely vital that the government publishes the evidence and its assumptions and all of the other things. Otherwise, we cannot have an informed discourse.
Okay, so we started at a high level. Let's zero in on one specific example. This came up briefly, this question of vaccine passports, right? So certification that you've received the vaccine and then presumably are safe to travel across national borders, that sort of thing. This is a discussion that it's pretty advanced in China. They've actually started issuing these passports. It's sprung up in the EU, in the UK more recently. In the US, it's just starting to percolate. Silkie, I want to turn to you. The idea behind these is let's make the most of the vaccine spread that we've already had. Let's free people to travel. Let's free people to take pleasure trips, that sort of thing. The president of the European Commission said this is going to facilitate Europeans' lives, make it just day-to-day quality of life a little bit easier. Why you don't think these are necessarily a good idea? Why not?
Well, we've just launched stopvaccinepassports.co.uk, so you can probably gather my position on the issue from that. This is really terrifying. I think the direction of travel, the fact that it does seem to be an international direction of travel as well. In the first instance, before I even get onto the civil liberties issues, I cannot really understand the serious rationale, like Phil said, necessity and proportionality is key. Are these necessary? No one's really made the case for that. I'm not convinced at all that they are. We still don't have conclusive evidence about the impact of the vaccinations on transmissibility. So at the moment, whether you've had a vaccination or not, you could be a vector for transmission. If the vaccinations do reduce transmissibility, even better, even less reason for us to have onerous controls on society, because infections are going to drop. And also, the effectiveness of the vaccine seems to be very high. Reports are saying, 80, 90%. So people are the groups who are most vulnerable, who are already in the UK anyway, being vaccinated, are very low risk. And I think, therefore, it's you start to wonder again: is this the product of a hyper focus and a kind of the political gain from doing this is then, I suppose, you've taken an extreme measure and can't be criticised for not doing enough around controls and related to vaccination. But the upshot of this is going to be disastrous. I mean, the product of it is that we would have a two-tier society, a checkpoint society, where you're expected to have this digital ID pretty much everywhere you go. I mean, the proposal here is that it's be something that's domestic, not just international, not just for travel. Even so, the World Health Organization isn't even recommending it for isn't even recommending vaccination requirements for travel at the moment anyway. And we will see marginalized people really suffer as a result. I mean, even starting with just the fact that the vaccinations are so early on, clinical trials are still ongoing with children and pregnant women, for instance. No public reassurance has been given about that and how it will affect those people. Lower vaccine uptake and more vaccine hesitancy with minority ethnic groups. Including in healthcare as well. And I would agree with Anthony that in healthcare is where this becomes a more difficult balance of rights. If someone is being treated who is at high clinical risk from serious illness or death from a coronavirus, then there's going to be a very strong argument for a requirement of that vaccine if it prevents transmissibility. But as a way to manage the general population, we're talking about potentially one of the biggest expansions of the surveillance state we've ever seen, a total reorganization of society, and down the lines of de facto mandatory vaccine. If you'd even told me that we'd be having this conversation a year ago, I wouldn't have believed it. I wouldn't have believed it. I find it shocking that it's an even semi-serious policy proposal, and it's I think what's most sobering about it is how quick human memory is to forget, and how perilous civil liberties are at the moment in the UK and the EU, because obviously the suggestion is in the EU, you have an EU-wide scheme for this. And I can't help but look at this with the lens of someone that's been campaigning around biometric identity systems, not as long as Phil, but for as long as I've been able to. There's been a push for centralized biometric identity systems for a long, long time, and it would be, it would just be simply untrue to pretend that there aren't a lot of commercial and government interests in having something like this on the back of, whatever kind of crisis society faces. So, I think to have come from, my parents' generation post-war, where that was the birth of the human rights framework, and values like privacy were enshrined in constitutional law, to now be growing, for now children to be growing up during a time where, it seems like we have completely forgotten why these values matter, and yet again seem to be devising policies that would suggest we have unconditional faith and trust in the goodwill of governments and corporations. It's just mind-blowing. I think this is if a serious policy proposal comes forward for vaccination passports, domestic vaccination passports in the UK and the EU, civil liberties and human rights campaigners, this has to be a key issue to fight on. We simply can't accept them, and I won't ever use one. And I think there are thousands and thousands of people, rational, sensible people like me, who wouldn't either.
Okay, I want to take a moment and welcome our last panelist, Eileen. Hi, Eileen, how are you?
Hi, I'm sorry I was late. I got way late with another event.
No,
sorry.
No problem. We're glad you're here now. So just by way of quick I'm sorry.
It's okay. It's okay. I can.
I was
going to
introduce you briefly. So okay, great. So Eileen Chubb, you're the founder of Compassion and Care. You're a former care assistant in the UK who became a whistleblower and now does whistleblower protection work. Thank you for joining us. So we're talking about this balance between civil liberties and the public health impact of the pandemic. You have a background in healthcare, work closely with healthcare workers. How do you think about balancing some of these concerns of we need to protect privacy, we need to protect civil liberties? Some of the people hardest hit by this pandemic have been healthcare workers. How do you think about that dynamic?
I think COVID has changed the world, and in many ways, quite frightening what's been happening. For example, we've allowed a whole sector of society based on their date of birth to be abandoned completely in care homes, and care staff who've been, whilst most of the NHS has been covered, on the TV and in newspapers, care staff have been abandoned to the mercy of big private companies. And we had care staff that were being told to take used PPE out of dustbins and spray it and reuse it. We had care staff who died for the want of a mask and were wearing things like tights as PPE. So that was the beginning of the loss of human rights, in my view. Then the government had a policy of discharging people with COVID into care homes where there was no COVID. And people didn't believe us when we started tweeting on this and putting out the policy and showing people. They thought it was so against everything that we're supposed to be as a civilized country that they at first didn't believe us. This policy has led to the deaths of thousands and thousands of people. And there's been hardly any mention of the fact. We had a situation where the kind of things that care staff were telling us, I mean, we've supported over 9,000 whistleblowers and the helplines are pretty busy anyway. But during COVID, we had a 60% increase in calls from care staff. Many of the staff raising concerns are no longer employed in the care sector because they basically they were forced out of their jobs. So that's a huge thing, firstly. but the government's policy of not sending people to hospital who were critically ill, and the fact that we had to do an FOI to obtain information on care home deaths in residential care homes because that data wasn't being published, and the government saw nothing wrong with that. And we found out up to June last year, 6,000 people alone died in residential care homes, many of them with conditions such as dehydration, because there was no medical staff in residential care homes. So people were left without oxygen. They were left without being able to take their normal medication, and they were dying from all sorts of complications as a result of that. And care staff were traumatized by watching people die in those circumstances. So yes, we have bombarded the government. I'm about as popular as a boil. However, we've been met with silence on all of these questions. And I think COVID has actually eroded human rights in this country to a degree that is horrifying. To see that people are being denied medical treatment based on their date of birth, that, you know, DNRs were put out on people, that care staff that cared about enough to say anything lost their jobs, and, you know, hundreds of care staff. So I think it's opened up a whole raft of questions about who are we as a society, and you know, and as a country that is turning a blind eye and almost accepting this. There seems to be somehow we've become desensitized, and we're accepting these awful abuses as if it's part of the COVID world, but it isn't, and it's frightening.
And Phil, I feel like I keep throwing these curveballs at you, but I'm going to throw another one. And then I'm going to ask you this question first, and then I'd love you to pick up on the vaccine passport conversation we were having earlier. Phil, are these civil liberties concerns? If we have people, as you know, we say because they're older Americans, because they work in healthcare, their freedoms are being restricted. They just have less ability to move around the country, or their work conditions are extremely difficult right now. Are those, we talk about civil liberties concerns very often about privacy, freedom of movement, that sort of thing. How does that sort of fit into your framework when you're thinking about how we balance some of these considerations? The fact that some of the people, the fact that healthcare workers are suffering at work is also a sort of, you know, that's a question of freedoms and liberties and that sort of thing.
Sure. But what I'm referring to is a human rights framework, not just a civil liberties framework.
Yeah.
And one of the fundamental human rights is a right to life. Yeah. And a lot derives from that. Yeah, we can talk about, you know, things such as privacy or your ability to move around, freedom of association, you know, and things like that. But yes, these are about people's fundamental rights, whether you classify them as civil liberties or human rights. And they are the things which the government must protect. The first job of government is to keep its citizens safe, yeah, and it should do that and must do that, you know, while respecting its rights. Yeah, there are extraordinary situations in which it may, you know, have to limit those rights in some temporary way, yeah, but, you know, it's falling down on the really major part of the job. As Eileen said, you know, we knew very early on, Sage and Sage care homes knew there was no ring of steel being put around the care homes. Yeah, we knew very, very early on that people with learning difficulties were being, you know, given a DNR, do not resuscitate orders, which is essentially a form of eugenics. Yeah, we knew that this was going on, and it is for the government to step in and defend the rights of those people who cannot do it for themselves. And if the government fails, then unfortunately people like Eileen and Silkie and myself have to step up and do the best that we can. But, you know, it's not, there's no dispute here that it is actually government's job to you know, create a situation in which, you know, groups of people's basic fundamental rights are not curtailed, you know, simply, you know, the government doesn't really want to sort of publish the figures.
So going back to this vaccine passport debate, you could look at that and say this is the government making it safe for people to travel. making it safe to make a living.
I fundamentally disagree. Vaccination, if it works, means that, and we're talking about this now in early March, in the UK at least, with the vaccination program proceeding as it does, by late May, July, it may be that most adults have been offered a jab, and if we believe the science, that means then we will have achieved herd immunity, which has come in for some kickings over the course of the pandemic. But vaccine accumulated herd immunity is very different from naturally accumulated herd immunity, and this is how we deal with infectious diseases like mumps and rubella and measles and things. So if the vaccine works, then the case for vaccine passports or vaccination passports diminishes, the more people that get it. I think, like Silkie and probably everyone really, I think there's very little the British government can do about international travel and some form of vaccination certificate, because that's other sovereign countries choosing what requirements they put on people who visit their country. And some countries right now who maybe lack vaccinations but need the tourist income are having to face that difficult choice of, do we let people in with some sort of certificate and expose potentially our population to risk, or do we keep that barrier up? But bottom line, what is needed here is nothing more than a piece of paper for international travel. We have had one, the yellow card, for many years for notifiable diseases. The WHO, I think, taken pretty much everything apart from yellow fever off that, but it used to contain things like cholera, typhoid, or what have you. But the point at which it just doesn't actually meaningfully prevent transmission from country to country, these things are not even relevant there. So we can be clever with, I don't know, a QR code or something like that, so we can link a particular piece of paper to a particular person's passport. There's some sense to that. But anything that leaves behind, like I was talking about with the contact tracing app, any choice, any decision here to do a digital only or digital first type of vaccine passport opens up the possibility of the domestic use of that, whether allowed or not, whether encouraged or not by the government, because once people have this certificate on their phone and it's generally understood that they're around, people will start asking for them. So keeping it associated to the actual passport means, in a situation where you wouldn't expect to be or wouldn't reasonably be asked for your passport, it's like there's a bit of a barrier there as well. So I think we need to be really, really sensible, really, really specific. And to, as we said, or I've said all along, balance out what is necessary and proportionate, and show how we know that.
Anthony, if we're defining the vaccination passport right now as something digital, something that's linked directly to your passport, and something that is selective, meaning you're getting it because we don't have herd immunity, so you're being identified as somebody who is free to travel, in contrast to people who aren't free to travel, is that a good idea, bad idea right now? Oh, I think you might be muted. Can anyone else hear him?
No.
It automatically. Can you hear me?
We can hear you now. You can start over, yes.
I was just saying, it's a very, very difficult question, because in terms of the vaccine, the way the rollout has been done, as we all know, is in terms of the age of the people who get it. So if you make a vaccine passport a necessary tool for travel to Europe or internationally, you're discriminating against people who, through no fault of their own, couldn't be vaccinated. And we don't want to have a society that's unfair in that way. Of course, the answer for people like me is to make sure that everybody gets vaccinated, but then we have to go to the point that Phil made very well, which is it's all fine for us to jump up and down in the United Kingdom, but we do not control what goes on in other countries, the United States or the European Union. And of course, I signally failed to answer your question as to how this issue is developing in the European Union? Of course, the answer is extremely badly. And for somebody who takes particular interest in Germany, as I do myself, not only in a big sense is it very ironic that the first big test of Brexit Britain against the European Union, and I should say I didn't vote for Brexit, the first big test for Brexit Britain against the European Union, which was on vaccination, has been won by Brexit Britain and not by the European Union. And we all know it's various reasons for that, perhaps nothing to do directly with Brexit, but that's the political fact that in the United Kingdom, we've had a resounding success. I don't forget the 124,000 people killed because of the, not totally because of the government's mistakes, but in part because of the, nevertheless, we're talking about vaccination. Britain has been a beacon in Europe and continental Europe, and Germany and France has presented us with a picture of a dog's breakfast. But I'd just like to make an additional point about this. I think there is an unfairness argument, but I do think that a vaccination, I don't in principle have a problem about a vaccination passport at all. And I'm of an age when I did have to have a passport for things like tetanus and diphtheria and TB in particular, that I used to have to take with me when I was a student studying in Germany 50 years ago. So it's not an issue for me. People have passports. They have, vast amounts of data on their mobile phones. I don't worry about that. What I do think is a concern, particularly listening to what Eileen said, because I thought her contribution was very telling. We've got to be very clear about what it is that we think went wrong. And what went wrong was not authoritarian, anti-civil liberty moves by the UK government, the German government, or the French government, or whoever. It was the reverse. What the governments got wrong was that they were trying to deal with a problem that could only be dealt with in an authoritarian way through experts telling people what they jolly well had to do. The government didn't do that, preferring its inclination, its gut instinct was towards a let it rip libertarian attitude. And when Phil says, he's glad that he and his colleagues put pressure on the government not to let GCHQ develop the Trace and Tracking Act, I would say of all the errors made by the government over the past year, one of the most ridiculous and sinister was the failure to do track and trace properly. It was a pathetic mess of government, precisely because they didn't want to do the one thing that would have made track and trace really effective, which is to tie an individual to their test results. And for me, that is an example of where an authoritarian solution would in fact have been to the greater good. Track and trace could probably have reduced the number of people dead in the United Kingdom by about 50%, but they didn't do it properly. It's still not been done properly. And it's significant that track and trace was done by the government with Dido Harding, who lurks somewhere in Whitehall. We haven't seen her recently. Whereas the vaccination program was done by the National Health Service, the chief scientific medical officers, and the government kept their fingers off it. They took the praise for it, but they weren't really involved. So if you extrapolate from that, the danger is that to do the right thing can require authoritarian measures. We have a government that doesn't want to do that, I know, but it can require them. And it means that what people are getting in effect is a curtailment of their liberty. Now, for people like me who are on the center right of politics, we have always distinguished between a freedom to do something and a freedom from having something done to them. And for me, it's a freedom not to die of COVID. And if the government has to resort to clear and firm action to do that, well, I'm in favor of it. If a vaccine passport can be fairly done and means something, I'm in favor of it. But I, just repeat what Phil says is absolutely right. We read about the Greek government saying, come to Greece, British people, with your vaccine passports. We'd love to have you here for holiday. Of course they would. But look at their vaccination record. Perhaps 6% of people vaccinated of any kind in Greece. And the government's quite incapable of doing the mass vaccination that we did in the United Kingdom, a very large country. Of course, they did it in Israel. But even there are serious civil liberties concerned. We hear in the news today the first time the Israeli government is giving Palestinians who work in Israel the vaccine. Why? To safeguard the Israelis with whom they work, not to safeguard the Palestinians. So that's an example of an authoritarian decision that takes liberty away. And I do think, this is a real debate we're having. I have absolutely no confidence in the British government, have no confidence in the German government, or the French government. I mean, they have taken the protection. Again, Phil is absolutely right. He may be surprised to hear me say it. The basic duty of a government is to keep people safe. What did Frau Merkel say to the Germans? She terrified them about any vaccine, in effect, but particularly AstraZeneca, the best vaccine. 1.5 million doses unused. 25% of Germans say they won't take them. Macron, against all the data, said, AstraZeneca doesn't work over people over the age of 65. Totally contradicted the science from the United Kingdom. So in the European Union, they have taken a big leap back. And the final point, in data and data protection, because that's really key for the future, how we in Britain use data and how our former partners in the European Union want to use data, whether they will exchange data and whether it will help people and help people retain their liberty and security. Those are really big questions. And at the time we're speaking, we don't actually know how any of that's going to pan out.
Anthony, I'm going to stop you. I'm going to stop you right there. Phil, I want to give you just a very brief time because I think you were sort of directly challenged on this contact tracing question. And then I'm sorry, just to tee up, Eileen, I'd love to get your sense, because one of the questions about contact tracing is there are these privacy concerns. There's also, frankly, I think there were some technology failures that we, at least in the US, didn't even get to the point of trying it out because we weren't able to figure out the technology. That's a question where very directly there's privacy concerns, there's civil liberty concerns where it could have helped healthcare workers tremendously, right? Reduce the load in hospitals very early on. So I'd love to get your sense of this idea. If we had leaned in on contact tracing, would that have helped healthcare workers? But Phil, if you could just very quickly respond, and then Eileen.
Okay. So very quickly, it's a test and trace program. That is a separate thing. To the COVID-19 app, which was, as we characterized it right back in April, an app for the next pandemic. People like John Cocroft at Cambridge have been building things like Flu Phone. This was an edge play. This was never fundamental. Test and trace, actual contact tracing, has all those extraordinary powers that it would always have to be able to link an individual to their test. That's how it's done. Now, there are some failures of that, but by and large, that is now sort of working. But the contribution of the COVID app has not been massively significant. And I would say, before you ask the sort of civil liberties questions, and even as a privacy advocate, you've got to ask the utility question.
Yeah. So why bother probing some of these privacy questions if it's, I mean, it's Silkie mentioned with the vaccine passport too, you have to answer the question, does it even make sense as sort of a tool before you worry about some of the applications of it? Eileen, can you respond to this question?
Yeah, I mean, I just want to touch on one of the earlier things that was said. Designated care homes, for example, were homes where people were going to be discharged from hospital with COVID into designated care homes. That whole plan was to deliberately mislead. Those homes were secret. Those people that were in the homes and their relatives had no idea those homes were a designated care home. That wasn't a government mistake. That was an attempt to mislead the public. And those are the kind of issues that are coming up here. On test and trace, many care workers that were offered tests early on were actually unable to go and take them because they were too far away, and there was no allowance made for people on low incomes that do not have a car. So simple mistakes like that were a disbarring thing for people to actually access. There was a lack of common sense as well, a total lack of common sense, and an awareness of people's working conditions and how are people meant to get 20 miles away if they haven't got a car. And that's the other thing. With the vaccine passports, there is an aspect of this which I think does impact on civil liberties. There are some care companies that are saying to care staff, if you do not have a vaccine, you cannot work. Now, these are people with no savings, that are on low wages, that are being threatened to have a vaccine, or you have no job. Now, what should be happening there is people should be given information. They should be given information and a choice, but that information is not reaching people that are frightened about the vaccine. And that is not, that isn't the way to approach it, is to force people. I think that that's a really frightening situation. And I think it can lead to a whole raft of other issues. So the government, in my view, and the evidence that we've had, which I could go on about for ages, is the fact that a lot of these things, if they weren't deliberately done, then the government have been given plenty of chances to answer our questions, which are all up on the website, and there has been a resounding silence and they have failed to provide the information. So I would say I rest my case as far as the government. I know that this was an unprecedented event, and you make allowance and you can tolerate a certain degree of mistakes and a learning situation, but this wasn't a learning situation. This was people were deprived of their human rights, and care home residents died in their thousands in awful conditions that needn't have died. And where does that line, stop being drawn?
Thank you for that. Sorry. Okay, we have about 5 minutes left. Very quickly, and I know I'm asking to rush here, about a minute each. Looking ahead to the second year of the pandemic, what's the one thing you hope to see happen in this sort of general field of civil liberties, that sort of thing? What's the one thing you most fear happening? And again, if we could keep it very quick, 1 minute. Silkie?
Well, I hope that coronavirus goes away. Obviously, that's what we're all hoping for. I think I'm hoping that this reinvigorates a general sense of civil liberties among publics, and we went through not a dissimilar thing after 9/11, when there was a huge power grab by governments, and civil society and citizens had to kind of reassert themselves and reassert their rights and liberties, and reimagine the kind of world that we want to live in. And we are at that crossroads now, because if you have the kind of authoritarian dreams that Anthony has, then of course you think that you can achieve goals by just brute force and brute power. And evidence tells us a really quite a different story. In fact, had the exposure notification app been centralized, people wouldn't have used it. Or if you look at countries that have mandatory vaccines, you actually have more negative attitudes towards vaccines. You don't necessarily have higher take-up. So I think we're all in agreement about the kind of goal and direction we want to have. We want a healthier, happier, freer society. The question is, how do you get there? And it's a time for anyone watching this already cares about that question. So it's a time for all of us to take action. And that's what we're going to be doing over the next year.
Anthony, very quickly, if I can ask you to answer that. Oh, you're muted.
What I hope for is that people will be prepared to be educated, particularly by the science-led community, as to how they can get out of this. What I fear is that the civil liberties lobby will confuse keeping people safe with somehow clamping down on them. And I hope in particular that people will understand that if they don't have the vaccination, they are harming their fellows. They are threatening the liberty of their fellow citizens. And as Her Majesty the Queen said about this, if you don't like the vaccine yourself, well, think of the people you're dealing with. Don't be selfish.
Okay, Eileen, hope for and worst fear over the next year.
I hope for a better political system where those that are in power are representing us better and listening to people's concerns and listening when people want more information, giving them that information, which isn't currently happening. And I hope for a world where we are all equal and all valued, regardless of our age or disability or anything else, that we are all valued as human beings, and that we have more access to know what's going on, behind the scenes. And because that is something that we're blocked on all the time, denied information all the time. And I hope for a world where there is transparency.
Excellent. Phil, last word.
Eileen took the words out of my mouth. No, I hope for a functioning parliament on the political level. I hope that the proper lessons will be learnt by the NHS and other public health institutions. This is not something for any particular government. I don't give a monkeys about whether Johnson's in power or May or whoever's next. We have to learn the lessons institutionally. What I fear is that some stuff will slip through that has really long-term consequences that was completely unnecessary and unproportionate or disproportionate, and that the government wasn't transparent about it at the time. I believe generally the British public has been ahead of the government in terms of sort of getting a sense of what they should do and doing it. Yeah. No, that's not everyone, but there's no sinister lobby here. By and large, people are doing what they have to keep themselves, their family, and other people safe. There's room for disagreement on that. What I hope we come to is a place where, when things open up again, we can all appreciate that we need to respect each other's human rights, because that's basically what you need to do as citizens. If you want your human rights, you have to respect other people's.
Okay, thank you. Seems like one of the major sort of foundational principles right now is the only way we're going to get this stuff right is we have an active, robust public conversation about it, and people engage sort of passionately and coming from good places. And you four are all doing that. So I thank you for doing that. I thank you for participating in this conversation, and I thank you all so much for watching.